So after seeing your eye doctor, more than likely you're going to be prescribed an eye drop or may need eye drops. And so what's really important is that if you are prescribed eye drops, that the eye drops end up in the eye. Very common for patients who've been prescribed medication to struggle to get them in the eye, and often the eye drops end up on the forehead, on the nose, on the cheek, in the mouth, and so it's really important to ensure that you know how to put them in, and if you aren't able to do it yourself, to ensure that there's someone there to help you, because it can be a challenge for certain people. So just basically, I'm going to explain how to do that. Here is just a bottle of lubricating drops, which I'm using here. This is your typical bottle with a cap. I think it's important to ensure that when you are putting your drops in, to clean your hands first and make sure you've got a clean environment, especially when you're taking the lid off your bottle, that it's not going into your pocket or onto a counter or something where it's unclean. It's quite a good idea to have a tissue or something that you know is clean somewhere. If you do put the top down on a counter, put it on its side and not directly like this. You want to try and prevent anything going there, and definitely don't put your finger in the cap at all, because when you apply that again to the top of the bottle, bugs can get in here and then you can contaminate your drops. So to make sure that you've washed your hands and you've got a clean surface or a tissue to put the top of the bottle on. Then be careful, some bottles have a sharp tip. They can be quite sharp. There's lots of different designs to bottle lids, especially if you've just had surgery and you push on the eye. You're wanting to avoid that. And you don't want the tip of the bottle to touch the eyes or your eyelid or anything. You want to keep this as clean and as sterile as possible. To apply the drop, bottles all work slightly different. Most bottles, just by squeezing the bottle gently, you can get a drop to come out. Other bottles do have a mechanism where you tap on the top. That's not this design, but some of them require a tap, and some of them even have a little button press at the top, which gets the bottle to come up, the drop to come out. And then some of them have an applicator where you actually have to, almost like an asthma pump or nasal spray, where you push a button to release it. But most of the time it requires just a gentle squeeze to get a drop out of the bottle. Now, almost all drops require one drop only. You don't need to put 2, 3 or 4 drops in the eye. One single drop into the eye is normally sufficient. If you need to put in 1 drop 4 times a day, a single drop 4 times a day is what needs to be done. A lot of patients come back to us after a week saying my drops are finished, and that's normally because they've put 2 or 3 drops in at a time. Instead of lasting a month, it lasts a week or 2 weeks, so that's also important. Then in terms of getting the eye drop into the eye, what we find a lot of patients do initially is they try and squeeze their eye open, or try and keep their eye open, and they try and aim and try and get the drop in their eye, and often that hits them somewhere in the face and doesn't go in the eye. So the best thing to do is just to put your fingers underneath your eye here. You'll feel there's a really hard bone right here, which you can push on. Even after surgery, you're not going to damage your eye. And then you just pull down the eyelid like that and look upwards. And what that does is it creates a little fold, or a little bucket essentially, to catch an eye drop just at the bottom there. And that's where you want to apply the drop. Now, obviously, when you're doing this and you're looking up, you now can't see your eye, and it becomes difficult to see where to put it. So often doing it near a mirror is helpful, and then you can look in the mirror with one eye, if I'm facing the mirror, and you can pull this down, look up towards the ceiling, and then drop it into that, what we call the inferior fornix, and catches that drop. If it's difficult, and this can be difficult for a lot of patients, get someone to help you. Look up, pull the eyelid down, and get someone to apply the drop. And again, not close to the eye. You don't want to touch the eye. You don't want to touch the eyelids or eyelashes. You want to make sure that the drops from the tip down into that inferior fornix, and then you can blink a few times. It's normally advisable to keep your eyes closed for a couple of seconds, and also to apply a little bit of pressure on the inside of your nose here for about 20 seconds. The reason we recommend that is that you have the drainage of your eye happens from the nasal side, from your nose. So any drops you apply as you blink, that starts to pump those eye drops down into your nose. And that's why you may often taste the eye drops. You may have a bitter taste or a sweet taste or a strange taste. That's those eye drops going down into the throat. That will happen. I know some people do struggle to keep their eyes stable, especially if you're a little bit shaky and you like this and you're struggling. Then one of the things that has been helpful for some patients is to rest the bottle of drops on your nose. So this does require a bit of coordination, but what some patients prefer doing is applying the bottle to their nose there, and they get to know where it needs to sit, and that supports the bottle of drops. So instead of it floating around and trying to aim, by getting into the position there and then squeezing it with their fingers, you can get that drop to fall into that inferior fornix, and that can work well as well. Now, for children, it can be quite a challenge as well. This technique can also be used for adults, but it often does result in a little bit of wastage of eye drops. And that's especially for children, to lie them down flat to make sure that they're looking up at the ceiling. And you need to get their heads right back. So normally it's much better if they're lying flat down on a table or a chair or a couch. And then you're going to apply the drop into the corner here. So this means that the eye is not open at that point. And so for children, normally as you try to pull the lid down, they shake, they pull away, and it's very difficult to get that eye open. And so what's very useful for that is to apply the drop with their head back into the corner here. And then once it's in that position, you get them to blink. And then as you blink the eye drop runs into the eye. Now, obviously that's not ideal. Often the drops do run down the cheek, and you may need to use more drops. But in a situation, especially with children, if it's a challenge to get the drops into the eye, then that may be a helpful tip. And then obviously afterwards, you want to cap your bottle and make sure that you store it in a clean, dry, cool environment. Some drops do need to be refrigerated, others don't, so that depends on the eye drop. So you'll have to check the package insert or chat to your doctor about the storage of it. But most drops, especially if they come in a bottle, have preservatives in them, but as I say, it does depend on the drops that you're using. I hope that's helpful, and just to reiterate, if you are prescribed drops, you need to make sure that they get in the eye. A lot of times I've seen patients who have been prescribed medication, and I've asked them to put the drops in and see that the drops often go around the eye and not into the eye, and then obviously whatever condition you're being treated for is going to be undertreated. But thanks for listening, and I hope that comes in helpful.